Hey, welcome everybody. I appreciate you coming. My name's Kurt Schertl. I'm the Chief Operating Officer of Weis Markets, and we're certainly pleased to welcome Governor Tom Wolf and Acting Secretary Klein Peter to our Camp Hill store. We want to commend the governor and his administration for their COVID immunization advocacy. Certainly, we're really proud to be a part of it. Maybe a little known fact that Weis Markets was one of the first retailers, not just supermarket operators in Pennsylvania, to offer the COVID shots probably, 18 months ago, Rick, or a little longer. I don't want to steal my VP of Pharmacies' thunder, but we've certainly given over 250,000 COVID shots, and we're very proud of what we've been able to mean to the community. This Camp Hill store is a great store for Weis Markets. Do a lot of great things here, protect our customers, protect our patients, not just pharmacy, but in our store as well. We happen to have a little snow scare going today, so we're a little busier maybe than usual. Andrew Campbell, Andrew runs the store, runs a great store, takes care of our customers, our associates, and keeps our associates and our customers safe. And as I stand here in front of a great pharmacy we have here, and our governor, certainly the partnership we have with the state, with our customers, and with our associates, we're very proud of. We're extremely proud of our associates. So with that, I want to thank the governor for coming to see us today at Weis Markets. Thank our customers. I hope we don't interrupt their shop. I apologize if we have. And certainly kick it over to Governor Tom Wolf. Governor?
Thank you, Kurt. Thank you, Kurt and Rick. Good to be here. And as always, Secretary Klein, good to see you. So thanks again for joining us, and thank you for everything that Weis has done for this effort. We're here to talk about the best way to stay safe during this pandemic, and there's one simple answer. I'm going to say a number of things, but get the vaccine, get boosted. That's the key, and I don't want to say that to oversimplify the situation we find ourselves in. COVID-19 cases have risen, and people are rightfully concerned about the short and long-term consequences of COVID-19 for themselves and for their families, especially when children under the age of 5 cannot be vaccinated yet. A spike in cases can be frightening, it can be frustrating, and it can certainly be disruptive. For all of us, that's been a big deal. My administration is working hard to distribute more resources for testing, more resources for vaccinations all across the Commonwealth, especially we can do this in the hardest hit communities. And we're sending more resources and we're sending more support to our healthcare systems too. The fact remains that the best way, fact still is, the best way to protect yourself is to get the vaccine, to get boosted. I know it can be hard to take time for one more appointment in a very hectic week, but making a vaccination appointment is still the most effective and important thing you can do to protect yourself and your family during this pandemic. People who have been vaccinated against COVID are far less likely to get sick than vaccinated people are. And if they do get sick, if they do contact COVID, vaccinated people are much more likely to have less severe symptoms. They're more likely to stay out of the hospital. COVID-19 vaccines and boosters are available right here in our community through local healthcare providers, through pharmacies like CVS, Rite Aid, Walgreens, Weis, through vaccine clinics, and again, right here in the grocery store, right here in Weis Markets. Vaccines are available all around us, and you can get them in the place that is most convenient for you. They're free, they're safe, and that might mean just getting your vaccine right here at the grocery store. The easiest way to find a provider near you is to go to vaccines.gov today. Again, my administration is taking this spike seriously. We continue to take critical steps to mitigate the spread of this disease. Back in December, I requested additional support from the Federal Emergency Management Agency to support Pennsylvania's healthcare system, and the federal government heeded our call. At the start of January, federal strike teams began deploying to hospitals and EMS centers in York and Scranton to help fight COVID-19 in our communities. This federal support is going to help alleviate pressure on our healthcare systems. I will continue to ask for more support from the federal government. That's the first thing. Second thing, also continuing to open additional testing sites, including a drive-through testing site that opened in Delaware County just this week. Testing, we're also doing testing, by the way, in every school district around the state that requests it. Testing is another important tool to help us all track this disease, to keep ourselves, our families safe, which is why the Department of Health has been hosting testing sites, particularly hard-hit rural communities. The Departments of Health and Education have also partnered with Concentric by Ginkgo Bioworks to provide free, as I say, weekly COVID testing sites to all participating schools. This is a free program. It's free. It's open to all K through 12 school districts, and it provides an important resource that helps students and staff, school-age families to protect themselves. Third, the Pennsylvania Department of Health and the Pennsylvania Emergency Management Agency, PEMA, are also launching regional support sites and our own strike teams to support hospitals facing staffing shortages. These strike teams are in addition to the federal strike teams that FEMA, I know it's hard to, FEMA is the federal, PEMA is the Pennsylvania Emergency Management Agency. We're doing our own strike teams in Pennsylvania. Fourth and finally, we're launching a new initiative to help long-term care facilities respond to the COVID-19 pandemic and to improve their resiliency. And this is important in the healthcare continuum to make sure that when somebody is discharged from the hospital, there is a place to go. This is important. Long-term care resiliency, infrastructure supports, an empowerment program that provides resources, consultation, and expertise to help facilities battle COVID-19, to recover and to rebuild. We will continue to monitor the situation in Pennsylvania closely, and will continue to take action to fight this pandemic. But again, every single Pennsylvanian can play a part in helping us to get past this spike. We can each play our own part by getting ourselves vaccinated and getting boosted. When you do that, you're not just protecting yourself, you're helping all of us get one step closer to the end of this pandemic. So thank you, and now I'm proud to turn this over to Rick Sipe, who's the Vice President of Pharmacy at Weis Markets. Rick.
Thank you, Governor. Thank you, Governor, for coming, and Acting Secretary Klein-Peter and Kurt. We both thank you very much for visiting the store today and for supporting the efforts that we have in the community and the Commonwealth has throughout the entire pandemic. We've been very proud of all of our associates, and especially our pharmacy teams who've really been on the front lines for the past 2 years plus. Over the past 12 months, Weis Markets and the pharmacies have administered over 350,000 immunizations and boosters of all ages. Our in-store pharmacies offer convenience and easy access. It's essential components for a successful immunization program, but also as a frontline provider for our communities. And as the governor said, we're not done yet. We still have to do many boosters and also immunize all ages, from ages 5 and up. Just want to make sure that that is the best way to be protected against this pandemic. We continue to work with the Commonwealth and pilot our oral COVID therapies that are actually starting to roll out into our stores in our 15 sites, and we look forward to continuing to do more. We thank you for all that they are doing in keeping our communities safe. And with that, I'll introduce Acting Secretary Klein-Peter. I'm sorry.
Thanks so much, Kurt, and Rick and Governor Wolf for being here today. I also just really want to emphasize the gratitude to Weis Markets for everything that they've been doing for their community during the vaccine rollout and now the therapeutics rollout. It's a pleasure to be with all of you this afternoon. As the governor outlined, his administration is simultaneously implementing a multitude of measures to help counter the effects of the current surge of the COVID-19 cases and hospitalizations. All of these initiatives are important, but let me be clear that every Pennsylvanian has a role to play in stopping the spread of COVID-19. There are clear personal mitigation measures that every Pennsylvanian who wants to end the pandemic should take to protect themselves and their loved ones. Get vaccinated to help prevent severe illness and hospitalization. Get a booster dose because it is proven to substantially increase your level of protection. Wear a mask in indoor public spaces regardless of your vaccination status. Get tested if you are exposed or develop symptoms, and then follow the latest isolation and quarantine guidance to protect others. As the governor said, we are working to increase testing capacity across the Commonwealth and ensure that the vaccine is readily available for everybody 5 and older. Meanwhile, wash your hands frequently, avoid crowds in poorly ventilated spaces, maintain physical distance to help reduce spreading the virus over the winter months. Before I close, I want to thank the nearly 8.5 million Pennsylvanians who have stepped up to do the right thing and get fully vaccinated. I want you to do 2 more things. First, get the booster. And second, if you know somebody who is not fully vaccinated, please urge them to do their part in helping to end this pandemic. We are still in this together, and it's going to take action from all of us to get us out of it. And with that, I'll turn it back over to Governor Wolf.
Thank you, Kira. So any questions? Yes. It keeps changing. The state has a site in Delaware County. The federal government may also set up a test site there. If they do that, we'll move the state site to another county, probably in south central Pennsylvania. I don't know, Kira, do you want to add to that?
Okay, sir. Yeah, so as the governor said, the Department of Health stood up a community-based testing site in Delaware County earlier this week. We also received news that we are going to be receiving a federal testing site in Delaware County called an ICAT. This site will be able to do 1,000 tests a day, and we're really grateful for the Biden administration's support. We are also looking to bring another site to Dauphin County. We are still going back and forth with the federal government. We're hoping to have good news to share soon. Thank you, sir.
It's continuing to change. Excuse me? Yeah, next week. And again, we're doing a lot of things to mitigate. We're trying to focus on keeping the healthcare system alive and well. And right now, as they get into a peak, we're doing everything we can to help them. Testing is actually a really important part of that, and it helps people figure out what they can do for themselves. And so we are doing more in the testing area. So we'll continue to do more and more. Anything else? It depends on the hospital right now and the healthcare system, but if you look back from the beginning of the pandemic, and I'll let the secretary talk about this, but if you look at it technically, there is some some flex in the system, but they're beyond the point where we feel comfortable. We feel comfortable when it's 80% capacity or 70% capacity. They're above 80% now. It's interesting, just as a little fact, only about 23% of the cases are COVID cases.
It's up a little now.
It's up a little bit. It's in the 20s. So most of the activity in hospitals is not due to COVID, but COVID is now something that they didn't have before, but it's on top of all the other things that the hospitals are facing, like this year we have a flu season. We didn't have it last year. That's stressing hospitals. We have a lot of pent-up demand that came because people put off procedures during the pandemic, or elective procedures were postponed. So some of those procedures are now due to happen, and some of the treatments that didn't take place during the pandemic really are in more acute stage, and so they have to take place. So the COVID cases are still a small minority of the cases, but hospitals are really struggling to keep up with what they need to do. Yeah, it's actually, the secretary pointed out, tell me, why don't you give the statistics? Get the truth, you get the right facts.
No, so the governor is spot on, but I would say that since we've last briefed him, the percent of total hospital utilization that's taken up by patients with COVID is up to 32%. So overall, our hospitals are doing a really good job of managing the extraordinary load that they're feeling on their own. So hospitals have an ability to reschedule or postpone procedures that perhaps could wait another week or two, or even longer, and they're doing a very good job of managing that process on their own. What we're seeing, though, is that the total number of people there with COVID is increasing, but the number of staff that are available is not increasing at a commensurate rate. And so that's why it's really important for every Pennsylvanian to do their part and help our frontline healthcare workers by getting the vaccine, by getting boosted, by staying home if you don't feel good, so that we have that capacity and that we're supportive of our, tired and burnout healthcare workers. After you, sir.
Herd immunity is a moving target, because I think when we first started this, when vaccines came out in January or December, everybody was talking about 70%. Well, we're there. We're over 70%. Now I hear
Yes, you're right.
90%. So I don't think anybody really knows what that means.
No, I agree.
Okay. Anything else? And by the way, that statistic, people in the hospital with COVID, that they may have that's anybody who has anything, including COVID. But a lot of those 32%, I don't know what percentage, are in there for also have something else, but they also tested positive for COVID while they were there. All right, thank you very much. And Weis Markets, thank you very much for hosting us. Thanks for everything you're doing.